NHA Test Training Tips 2026 National Healthcare Association. All you need to know. Question 1. Where do cardiac electrical impulses originate in the heart? Atrioventricular node, sinoatrial node, bundle of His, Purkinje fibers. The sinoatrial (SA) node is the primary pacemaker of the heart. Question 2. According to the regulation of controlled substances, which of the following is true of a Schedule I drug? High potential for abuse and no accepted medical use. Low potential for abuse and high medical use. Moderate abuse potential and requires a written prescription. Sold over the counter without a prescription. Schedule I drugs have a high potential for abuse and no currently accepted medical use in treatment. Question 3. A medical assistant is testing a patient's visual acuity using a Snellen chart. Which action is correct? Have the patient stand 5 feet away. Instruct the patient to keep both eyes open while one is covered. Allow the patient to lean forward for better view. Let the patient choose which letters to read. When testing with a Snellen chart, patients should keep both eyes open even if one is covered to avoid squinting. Question 4. Which of the following additives should be used when performing a CBC, complete blood count? Sodium citrate, lithium heparin, EDTA, sodium fluoride. EDTA is the anticoagulant of choice for CBC because it preserves cell morphology. Question 5. Which of the following cell structures is the primary source of energy for a cell? Nucleus, ribosome, mitochondria, lysosome. Mitochondria are the powerhouses of the cell, generating ADP. Question 6. What does the abbreviation PRN stand for? As needed, immediately, by mouth, twice a day. PRN is Latin for pro re nata, meaning as needed. Question 7. Which instrument should a medical assistant prepare for a physician to examine a patient's ears? Ophthalmoscope, otoscope, sphygmomanometer, tuning fork. An otoscope is used to view the ear canal and eardrum. Question 8. Which technique should a medical assistant use for the routine cleaning of EKG cables? Sterilization, disinfection, autoclaving, wiping with plain water. Disinfection is the appropriate level of cleaning for non-critical items like EKG cables. Question 9. A medical assistant is preparing a patient who has anemia for an examination. Which manifestation should they expect? Irregular heartbeat, increased energy, flushed skin, high blood pressure. Common symptoms of anemia include fatigue and an irregular heartbeat or palpitations. Question 10. Which of the following positions is most appropriate for a patient during a general abdominal exam? Prone, supine, lithotomy, Fowler's. The supine position, lying on the back, is used for abdominal examinations. Question 11. The patient's Bill of Rights protects individuals from which of the following? The cost of healthcare, denial of care due to the patient's age, all side effects of medication, long wait times in the clinic. The patient's Bill of Rights includes protection against discrimination in the delivery of healthcare services. Question 12. What should a medical assistant do first when preparing a community resource library? Print pamphlets, call the local hospital, compile a list of local community agencies, order books on health. The first step is identifying and compiling the relevant agencies. Question 13. When disposing of a needle and syringe after a vaccine, what action is correct? Recap the needle before disposal. Place it in a regular trash can. Drop the syringe needle first into a biohazardous sharps container. Separate the needle from the syringe. Needles should never be recapped and must be placed in a sharps container immediately after use. Question 14. What is the purpose of a CMS 1500 claim form? To document patient vitals. To file for insurance reimbursement for outpatient services. To record a patient's history. To provide a receipt to the patient. The CMS 1500 is the standard form used by healthcare professionals to bill insurance carriers. Question 15. Which of the following is a characteristic of a patient with psoriasis? Silvery, scaly skin lesions, moist, red blisters, deep purple bruising, yellowing of the skin. Psoriasis is characterized by silvery, scaly plaques on the skin. Question 16. If a patient reports an allergy to penicillin and is prescribed amoxicillin, what is the MA's immediate action? Administer the drug. Ask the patient if they are sure. Notify the provider immediately. Give a smaller dose. Amoxicillin is in the penicillin family. The provider must be notified to prevent an allergic reaction. Question 17. Which of the following is an example of an expanded problem-focused history? Focuses on the chief complaint only. Includes the chief complaint and a brief review of systems related to the complaint. Includes a full physical exam. Includes family and social history. An expanded problem-focused history includes the CC and a limited review of systems. Question 18. Which of the following dressings should be used on a partial thickness burn? Dry gauze, non-adherent dressing, adhesive bandage, plastic wrap. A non-adherent dressing prevents sticking to the wound and trauma upon removal. Question 19. What describes a pulse that is not easily felt and disappears with slight pressure? Normal, 1+, 2+, 3+. A 1+ pulse is described as weak or thready. Question 20. Which term describes the death of tissue, often seen in severe frostbite? Remodeling, proliferation, necrosis, inflammation. Necrosis is the death of cells or tissues.